Hello and welcome to our special show. The topic of men's health, both physical and mental, is often swept under the rug. It's important to remember that men's health is not just a man's issue, it is a family issue and can impact everyone around them. Hormones play a powerful role in the body's regulatory system. Proper hormonal balance is essential to maintaining optimal health and plays a crucial role in how one feels. Like women, men also undergo changes from childhood, and these include physical and hormonal changes. Men tend to accept changes in their bodies as just part of the aging process. However, most symptoms of aging are actually caused by hormonal imbalances. Fortunately, male hormone imbalance can be successfully treated. Living a long, healthy life is easy if you know the symptoms and prevention strategies. Today, we have with us eminent endocrinologists who can help you understand and manage men's hormonal health. We're joined by Dr. Sunil Jain, endocrinologist, Total Diabetes Hormone Institute, Indore, Dr. Sujit Arun Chandratraya, Endocare Super Speciality Clinic, Nashik, and Dr. Nikhil M. Bhagwat, endocrinologist, Breach Candy Hospital, Mumbai. Thank you so much, doctors, for joining us. Dr. Jain, the first question to you. The hormones created and released by the glands in your body's endocrine system control nearly all the processes in your body. So what are the male-specific hormones and their role?
Yeah, so as you mentioned about the hormones, so let me talk about the male hormones to which we call androgens. Now, a man body produces two important hormones, testosterone and DHEA. One is coming from testis, other is coming from adrenal. These are the endocrine glands. And now, this testosterone is considered as the most important hormone which is produced by man. And this hormone is being produced from a special group of cells lying in the testis. And this testis is under the control of pituitary gland. Now this testosterone will circulate in the blood and will reach to the various body tissues, and it will have its effects. And the most important effects of testosterone are both sexual and non-sexual. Many perceive this bit wrongly, that it is just a sex hormone. It is a lot of things, like a boy which develops during puberty happens under the influence of testosterone. In a man, desire, performance, all depends on testosterone. But more important than that, testosterone is important for vitality, for energy, for maintaining muscle mass, for creating hemoglobin, and very important is the bone health. So testosterone is a very important male hormone circulating in the blood.
All right, so that's important to keep in all these factors in mind and the importance of hormones in males. Dr. Arun, can you enlighten us on what are the common hormonal disorders which are common in males?
Yeah, actually in males, the most common hormonal disorders are those disorders which are found in the population, like diabetes mellitus, thyroid disorders, obesity, erectile dysfunction. But if you refer to the male sexual hormone problems, it is mainly the hypogonadism or low testosterone values. That is the main hormonal disorder of sexual related in males, we can see. The typical male hormone starts declining from the age of 30, and there is something called hypogonadism in fertile period, which can be because of pituitary or testicular disorders. Or there could be something called late onset hypogonadism, which is equivalent to menopause in ladies. And it's also used to be called andropause, or now the term is male menopause or late onset hypogonadism per se. As we know, the slight difference from the menopause in ladies would be not all the males would be affected, and there is no complete shutdown of gonadal or reproductive system in males. So these are the commonest male sexual hormone related disorders actually found in the society.
All right, Dr. Bhagwat, can low testosterone go away without treatment? Is low testosterone something that is permanent?
Obesity is a major problem nowadays, and this is because of our altered lifestyle and food habits. Obesity can cause insulin resistance, which can be a precursor for development of hypertension, type 2 diabetes, and obstructive sleep apneas. And all these conditions can result in low testosterone values. Now, by changing your lifestyle, becoming more active, being physically active, and taking care of our food, one loses weight, and weight loss can result in elevation of testosterone values. So this can be one of the reversible causes of low testosterone. Besides this, if a patient is going through a lot of mental stress or if he has any febrile illness, then also the testosterone values can be temporarily low. There are certain medications which can also result in low testosterone values, and if these medications are stopped, the testosterone values can come back to normal. So these were all the causes of temporary reduction in testosterone values. But if there is a trauma to the testes, or if there is an infection or inflammation to the testes, like mumps, or if there is a condition which affects your pituitary, like a pituitary tumor, or if there is a surgery to the pituitary gland, or if there is a radiation therapy given to the pituitary gland, all this thing can result in low testosterone values, and these conditions can result in permanent decrease in testosterone values.
Dr. Jain, now what are the possible causes of low testosterone levels in men? If you could explain that to our viewers.
Yeah, so few of the causes were already told by Dr. Bhagwat, but let me explain you a little in more detail. Testosterone is produced from testis under the control of another gland called pituitary. So any disease which affects testis can cause low testosterone. Any disease which affects pituitary will cause low testosterone. And it's very important that such patients should be given testosterone treatment, because I have explained the importance of testosterone in the blood of man. Now, there are conditions where testosterone deficiency can be due to birth, and their puberty doesn't happen in boys, and they look like kids even at the age of 20-25 years. And unfortunately, many such diagnoses are delayed, so they should be timely diagnosed and timely treated. And already discussed, the lifestyle is another big issue. This is a new cause of testosterone deficiency. Earlier, we were talking mainly of the hypogonadism due to pituitary or testicular causes, but now the lifestyle disorders, because they also lead to changes in many hormones like leptin and certain adipocytokines which are coming through fat. So a healthy lifestyle is also very important, and that is another important cause of testosterone deficiency in present world.
All right, Dr. Chandratriya, what are the signs and symptoms of low testosterone, and how can one be sure if these symptoms are due to, low levels of testosterone?
The signs and symptoms could actually involve the sexual symptoms, mental symptoms, physical symptoms, psychological symptoms. So they include mood swings, depression, irritability, lack of stamina, weight gain, that is fat gain, central obesity, muscle mass loss, lean body mass loss, weak bones. Some people tend to get gynecomastia, reduced body hair loss. There could be reduced libido, sexual desire loss. There could be erectile dysfunctions. The ejaculatory volume can become low also. Some people tend to get hot flashes, but the hot flashes are not as common as compared to menopausal ladies, because the reduction in the hormone is not really sudden. It's a very gradual process. As we know that these symptoms are fairly common, and many other disorders like say depression, thyroid disorders, kidney or liver disorders can come up with the similar kind of symptoms, we should be absolutely certain, and the diagnosis comes only with the laboratory tests. Unless we have a diagnosis in the hand, we cannot really think of a treatment or replacement of any hormonal therapy. In fact, all over endocrinology, the treatment is actually dependent upon the test and the complete biochemical diagnosis.
All right, Dr. Bhagwat, what is the role of testosterone replacement therapy to treat low testosterone? Is this a safe therapy?
The best treatment option is to start with testosterone replacement therapy, and it is very, very safe. The benefits are immense. It can improve libido, energy levels, can increase muscle strength and muscle mass, and reduce adiposity, that is fat mass. It can also increase the bone density. The testosterone replacement usually is given by intramuscular testosterone injections, and the effect of this injection can last for about 3 to 4 weeks. We look at the testosterone levels in between to adjust the frequency of injection. Nowadays, we have a longer acting testosterone depot which works for about 3 months. Out in the West, there are testosterone patches which you can apply to the skin, but these are not available in India. Currently, testosterone tablets are also available, but the efficacy of these tablets is not known. But if we make the right choice of the patient or the patient does not have any contraindications for testosterone therapy, it can be very, very, very safe. The contraindications are if the person has any CA prostate, that is the cancer of prostate, or breast carcinomas, or underlying cardiovascular disease, or obstructive sleep apneas, then the testosterone therapy is contraindicated. Once we put the patient on testosterone therapy, we periodically look at their CBC to look for rise in hemoglobin. We look at their lipid profile. We look at their prostate surface antigen to see whether it is causing any problems in their prostate. And if we get any red signals, then we definitely stop the testosterone therapy.
All right, Dr. Jain, what is the role of diet in the management of low testosterone levels? Can one, manage their hormones through their diet as well?
So here we have to understand this very important point, that if there is a testosterone deficiency which is permanent, that is some testicular damage is there, or there is some pituitary problem, so the hormones are not coming from pituitary gland which stimulate testis to produce testosterone. In both these conditions, that is a primary disease of testis, primary disease of pituitary, whatever is the further details are, this person is having testosterone deficiency, and this person should be supplemented only and only with testosterone. There is no substitute for testosterone which can come from dietary route. So it's very critical that the people should understand this, that if they are having testosterone deficiency which is diagnosed in a relatively younger age, it is very important to keep their hormonal system normal, because there are many myths about these words like hormone and hormone therapy, but testosterone replacement will be essential. So in such patient, practically there is no role of diet there, we have to supplement testosterone. But another subgroup which we talked as a temporary testosterone deficiency, which is due to lifestyle, where people have a bad lifestyle, eating junk food, add a lot of central fat on their body, and now this fat is producing many chemicals which is interfering into the testicular and pituitary function. Here comes the role of diet. These people should lose their body weight, adopt a healthy lifestyle, go for a high protein, low carb, low fat diet, and that's how they can have some improvement. Though certain supplementation, they are talked so much, but I tell you, the major mechanism to handle in a patient who is having obesity and temporary lifestyle issues, they should focus on the lifestyle, while those who have permanent testosterone deficiency, they should religiously, properly replace testosterone. That is for their long-term benefit.
All right. Well, thank you so much, doctors. We'll slip into a short break and come back with more questions about health and hormones. Stay with us. Welcome back. We're talking about male health and the role that hormones play. Well, let's go across to the doctors who are joining us. And Dr. Chandratreya, does exercise increase your testosterone level?
Yeah, when we say exercise, it could be of many types actually. We have got flexibility exercises, cardio exercises, muscle training, strength training, walking, trekking, and so many other types are there. So we know very well from 1990s that good muscle training can increase serum testosterone levels. And Dr. Kramer had done some work here. Not only testosterone, we get increment in the growth hormone and hormone called IGF-1, which is very, very beneficial. But that only comes after good muscle training. More is the volume of the muscle training, more is the testosterone peak. That is what is said. However, one thing has to be remembered, that those peaks related to the exercises are actually lasting only for 90 to 120 minutes, and they don't last throughout the day. So a person has to keep on repeating the exercises. Somebody stops muscle training, the benefits are actually lost. Somebody indulges in a very long, say, trekking or a day-long kind of exercise, that actually can cause overtraining effect and can increase a hormone called cortisol, and that actually can take away the benefits of serum testosterone, or in fact reduce testosterone values per se. So it depends upon which exercise, how long it is done, and what way it is done, really speaking. And we have to know that short bouts of intense muscle training would be very beneficial for males to increase the serum testosterone values.
Right. Dr. Bhagwat, when it comes down to men's health, people try to hide it. What advice would you give men regarding their hormonal health?
So when it comes down to men's health, many patients tend to hide their problems. And it is our societal norm that men have to be strong and they cannot complain about their problems. And because of that, many men suffer internally. So my advice to them is please do not hide their problem. Open up because there are solutions available to this. Besides this, if you don't open up, your quality of life is drastically going to deteriorate, both physically and mentally. So I would suggest them, please seek an advice of your doctor, share with him his problems, and both can work towards addressing them.
Dr. Jain, if we can talk about substance abuse. Now, this is something that is common among men. How does substance abuse affect hormonal health?
Yeah, so in fact, this has become a very important issue nowadays. And I tell you, as an endocrinologist in our practice, we keep asking people also for the substance abuse, including, I will come to one by one, including anabolic steroids. And at many places, they are recommended by non-doctors and patients are using them. We are aware about the athletes and substance abuse. So this has become a important topic in terms of male hormone health. Now, if we talk one by one, suppose we take alcohol. Now, if alcohol consumption done in a smaller quantity, that is fine. But the people who are using a large quantity of alcohol, it is shown that alcohol reduces testosterone production in man and then it has its own consequences. So obviously alcohol consumption should be brought down or should be omitted in people with low testosterone levels. Another area is the use of substances like marijuana, opioids, and there are so many substance abuses going on. It has been observed that these substances work on both testis and pituitary gland, and that's how they are causing a low testosterone state. And as we have already discussed, the effect of low testosterone state is not just the sexual health, it has a lot of effects on human body. So that's how this substance abuse in long term will be very bad. But one big trend which is going on is using anabolic steroids for bodybuilding, etc., etc. And there not only anabolic steroids, many other hormones are also being used. Here we are using something which is available for a healthy purpose in a wrong direction. Now, if somebody is injecting a testosterone or similar product for as a substance abuse, anabolic steroid, etc., what it will do? Now it will cause reduced secretion of the regulatory hormones from pituitary, and that will have a negative effect on testosterone production and sperm production. And finally, the day when these people will stop anabolic steroids, they are going to face a big problem of low testosterone state, because by using these substances, they have interfered in their natural hormonal system. So it's important that current generation should understand this and try to avoid substance abuse.
All right, very important to keep in mind, especially, as you're saying, a lot of people are advised substance such as steroids by other people other than doctors and the impact it's having on their health. Dr. Chandratriya, prevalence of central obesity is common in men. Can hormonal imbalance cause obesity in men?
The central obesity is increasing by leaps and bounds in our country. In fact, it's hard to find a male more than say 25 years to have a flat tummy nowadays, really speaking. It's a big problem now. Though the hormonal systems are partially responsible for it, and there are multiple hormonal disorders which actually would cause or contribute to central obesity, the main thing is lifestyle abnormalities. Having said that, there are multiple hormones involved in the weight regulation. So we have got insulin resistance syndrome, which is very common in our country. The sensitivity to the insulin, the metabolic hormone, goes down. There are various hormones involved in the food regulation intake, leptins, ghrelins, a hormone called cortisol, which is a stress hormone, which comes in higher quantities that can contribute to central obesity. Talking about testosterone, what we are discussing today, low testosterone, as we said, can actually cause muscle mass loss, bone mass loss, and increase in the fat. And the fat deposition is mainly around the tummy. It could be also intraperitoneal fat, and that is the fat actually which can contribute to various lifestyle disorders like high blood pressure, high cholesterol, diabetes, and heart disorders later on. So the typical syndrome X in males is a trouble, and that is one of the most important troubles which we can actually encounter in the coming years.
All right, finally, Dr. Bhagwat, can low testosterone cause severe anxiety?
As Dr. Sujit Chandratre said, that low testosterone can cause a functional impairment in day-to-day life. It causes decreased sexual desire, decreased sexual activity. It can result in erectile dysfunction or decrease in spontaneous erection, can result in infertility. Besides that, as he had said, there is increase in fat mass and decrease in muscle strength. So these patients feel very weak. They don't have strength to do day-to-day life. Along with that, they may have a little breast discomfort and swelling of the breast, which is called as gynecomastia. So feeling low, feeling sad, depressed, all this can affect the functional capacity of the patient and can lead to severe anxiety.
All right, doctors, thank you so much for joining us on this program and talking about this important issue, the role that hormones play in male health. Thank you all for watching at home. Goodbye.
Thank you.